was a lecturer who taught medicine. And after me failing one of my exams in my first year, he was my tutor. So he basically said to me, Francis, if you keep going the way that you're going, you're not going to make it through med school. And I remember at the time when he said that to me, I was really annoyed with him. I was thinking, how dare he say that to me? But I think that looking back at that sort of experience, he said it for a reason. He didn't say it because he wanted me to be kicked out. He said it because he knew that I wasn't working to my potential.
Welcome, guys, to another episode. Today, we've got a special guest. We actually went to school together in Derby, Little Over Community School, and then sixth form college in the Millennium Centre in Little Over as well. He's actually a medical doctor, young medical doctor in Birmingham. I'll let him introduce himself and what he's doing, but welcome to Dr. Francis Okoroh.
Really, really appreciate those kind words, Arnold. Now, me and Arnold go back an extremely long way. So my name's Francis Okoroh. I live in Birmingham, and I've been a qualified GP for 3 months now. Been a qualified medical doctor for 5 years and 3 months now. So time really flies. But it's an honor to sort of have a conversation with you because we've been through so much over the years. And I think that actually looking back at all the little steps where we doubted ourselves and seeing where we are now is something for us to talk about and share our stories.
Yeah, and a big part of my audience are aspiring dentists, and they come to that crossroads of, do I want to become a medical doctor or do I want to become a dentist? How do I even make that decision? So just let us know a little bit about what are you doing day to day? What does your role include? Just give us insight into what you're doing.
Right. So at the moment, I'm a qualified GP, and my role entails being a part-time salaried GP. So what that means is that I'm contracted to work for a particular practice in Birmingham 2 days out of my week. For the other sort of 5 days in the week, I do different things. So currently, I've got a locum contract covering a maternity locum role 2 days out of the week. So that's in a different area in Birmingham. So that's two separate practices at the moment. And then on a third day, so on the middle day during the week, on the Tuesday, I work in a practice as a locum as well in Leamington Spa. So that's probably like a 35-minute drive. So I think the blessing from all of that means that I'm able to have a variety of work, and given that I'm a newly qualified GP, it's important to get your feet wet and sort of try different places, because in the long run, it helps you realise what sort of areas do you like to work in, what sorts of GPs do you want to work alongside, the patient clientele, and it differs in all these different areas. And obviously there's the options of doing out of hours, so working in urgent care, to kind of mix things up.
All right, so it looks like you're doing a whole lot there. You're gonna have to break it down for us so that we can really understand what that means for you. But let's start back at how you even got to this stage. So sixth form, secondary school, sixth form, we're doing GCSEs, A levels. Did you know from a young age that you wanted to become a doctor?
Well, it's a really, really interesting question. I think that if I'm being perfectly honest, having Nigerian parents sort of geared me into a particular direction. So from a young age, they always pushed education. And I think that for me, I enjoyed the science subjects. And it was always an aspiration from the age of probably about 13, 14, to try and gear things towards medicine. I didn't actually have that many people around me that were doing medicine, apart from a few sort of family friends. But there was a group of us, if you remember back at school, and we were all sort of talking about medicine. So I think that having friends around us and doing similar subjects and being competitive academically sort of geared us into medicine. And I guess that all the natural steps have progressed into that particular direction.
Yeah, I've asked you this before, but did you ever consider dentistry?
So I've got two left hands, I can't even lie. So dentistry would not be for me, unfortunately. I think that I have great admiration for people in that particular field, because even doing simple procedures on a day-to-day basis in sort of medical land, in GP practice, I try and keep away from those side of things. So I know my fortes, and I think that the dexterity that's involved in dentistry is something that I don't quite have.
Yeah. Well, I remember those days in secondary school and sixth form, particularly sixth form, I think it really does matter the group of people that are around you. Because I think for our further maths class, now that I think about it, it was kind of extreme. I think people were upset if they weren't getting 90% in test results. 90,
Right.
you know, what do you think? Do you think the people around you make a big difference in how well you do?
Yeah, I do actually. I think that you are a product of the environment that you're in. And I think
Mm.
that we had an extremely competitive sort of group of friends.
Yeah.
And it's actually ironic because I think that going through sort of secondary school initially, you kind of are condemned to an extent for being intelligent and you're almost trying to hide your intelligence. And then there's a transition between that and sixth form where actually it's cool to be intelligent. And all of us were kind of like asking, what did you get in that test? Did you get 91%? I got 93%. So kind of having that sort of competitiveness that was friendly, but sort of it made us think to ourselves, okay, I must strive to achieve to my true potential.
Yeah. What about if you don't have that group of people that are actually wanting to do well academically? What can you do if the people around you just don't care about getting good grades? How can you get yourself into a position where you can be around people that actually want to do well? Is there anything you can do?
I think it's difficult because I think that if you don't have people who look a certain way compared to you that are in certain roles, or you have people around you that are kind of trying to keep you on the straight and narrow, it can be extremely difficult. So I think that from my perspective, things that I do, and I'm sure I know that you do yourself as well, is trying to mentor people who might be 5, 6, 7 years behind you and kind of showing them, okay, I was able to achieve this. These are the steps that you need to take. And I think that having role models that you can aspire to look like, or aspire to be like rather, is something that's really, really important.
Yeah. All right. What was the experience of medical school like? So you were in Derby and then you ended up training to become a medic in
Yeah.
Leicester. So what was that experience?
Well, if people don't know, me and Arnold were in Leicester for a period of time together. So we were in Leicester from 2010. So 10 years ago now. Time really flies. Medical school was interesting. I think that if I'm being honest, I didn't necessarily work as hard as I wanted to in the first few years, because I think that initially when you get to university, you kind of get blinded by the headlights and you almost sort of lose track of why you're there. But medical school itself, it was one of those experiences initially where towards the end of the year, you kind of get ready for your exams and you kind of crammed all the things you needed to know to get through the exams. And then it was only up until my 4th and 5th year that I realized, okay, I'm actually going to be practicing in a few years' time. I really need to work. And I think that in those last 2 years, I was a bookworm. I did not get my head out of the books. I was working hard all the time. I had to compromise my social life. But I think that actually medical school is really, really competitive once you're in there. But you meet people in there that you sort of bond with, and there's people I talked to since then. So I think that it was an invaluable experience. It was something that helped me to prepare really well for what I do on an everyday basis. And there's definitely things that I learned knowledge-wise that I still refer to back today.
Yeah. So I want to ask you, when during medical school did it click that you had made the right choice? So when because we went to Leicester, Uni of Leicester together.
Yeah.
I think it was my first year doing medical physiology, biological science.
Right.
And because I got to know, you and the other medics that were doing medicine. That made me realize that medicine wasn't for me.
Yeah.
Being able to see, what you guys were going through, and how you guys were progressing, it just it highlighted to me that, you know what, this is not going to fit me and where I want to head.
In what way? In what way would you say that?
Say that again.
In what way would you say that?
So even the way that you had to do a lot of theory and reading. Yeah, dentistry. There is some of that in dentistry, but theory, the reading. I think I was now becoming more aware that once you had finished all of that, you still had a long way to go until you were independent as a clinician. And in the UK, medicine doesn't lend itself to business. naturally like other countries.
Yeah.
And for me, business is a big part
Yeah.
of what I want to be doing with my future. So it's things like that I was now saying, can I really see myself in this? Forgot where I was going now. Okay, yes. The other thing was the fact that during my first year of uni, I was doing bad in my exams, mainly because we were finding ourselves in the gym at like 1 a.m., 2 a.m. You know, would be at parties, a club. Like my head wasn't in the space to be committing myself to a degree. So definitely, if I got into medicine first time round, I probably would have been kicked off the course or something because
I'm gonna share something with you as well, actually.
Yeah.
So because of that, I failed an exam in my first year and I failed an exam in my third year. And me and you have never been used to failing exams ever in life. And the reason for failing wasn't because I didn't know the sort of theory, it's because I didn't do the work. So I actually remember going to an exam in my first year and I probably revised for the exam for like a total of 4 days.
Wow.
And I don't know what was wrong with me in the sense that right now and in my fourth and fifth year and any postgraduate exams, I would never put myself in that sort of position. But I think that there's a maturity process that happens during university where you realize, okay, I'm here for a reason. Like I cannot mess up my future. And I think that once that switch flips, then I realize, okay, now I'm focused.
Yeah. So yeah, that initial uni experience for me made me realize what I really wanted to do.
Yeah.
But for you, when did you realize that, okay, this I made the right decision?
Being honest with you, I don't think you ever 100%, well, in my personal opinion, fully sort of realize that, okay, there isn't necessarily another career that I would also thrive in. But I think that the thing that sort of clicked for me was when I realized, okay, I'm actually good. So in my fourth year of medicine, I started to doubt myself because of the fact that I'd scraped through a few exams in my first 3 years. And in the fourth year, when I actually put my head down, I actually got a distinction in my exam, which means that you're in the top 10% in the year. And I think that actually realizing if I put my mind to this, I'm actually good. I think that knowing that you're sort of doing well at sort of whatever field that you're in and realizing actually I can bring something to this particular field makes you more interested, because when you actually see results of what you're putting in, then that makes you sort of satisfied and makes you sort of realize you're on the right path.
Yeah, no, that's good. That's good. Would you consider yourself, okay, I'll put some things to you. Do you consider yourself Nigerian? Do you consider yourself English? Do you consider yourself Black? Black Nigerian English? Like what do you consider yourself?
I think that I definitely identify with my culture. I consider myself Nigerian for sure.
Yeah.
I think that culture is really important. And I think that that one of the reasons why I am where I am at the moment is because of my culture. Because I'm sure you know this, and similar to your culture as well, we have sort of principles that are drilled into us from a young age in terms of education, in terms of family values. And that's the reason why you and your brothers and family are so close. And that's the reason why I'm really close with my siblings. And I think that I definitely identify with being Black and Nigerian, living in England.
So how was that then, being Black Nigerian in medical school? Did you feel accepted? Did you feel like you belonged? Did you feel like there was representation? From what I saw, it seemed like there was a diverse range of people within the medical course. How was it for you? You being in it?
Yeah. So in my year, off the top of my head, there were probably about 4 other Nigerians. There was a Black Ghanaian girl. There was maybe about 2 Caribbean people in my year. I think in total, out of the 320 people in the year, there was probably about 10 to 15 Black people, either of African or Caribbean descent. So I think that's decent representation, but I think that obviously it could have been better. And I think that from a personal standpoint, especially being as tall and noticeable as I am, you sometimes feel like you stick out like a sore thumb. But I think that the important thing is to sort of stay motivated, stay hungry, stay sort of focused as to achieving the task at hand, which is to get through. and to make something out of yourself.
Yeah. Yeah. Well, what are you now? 6'7"?
6'7", yeah.
6'7", okay.
If I'm stretched, I'm 6'7.5".
Half. I know.
Yeah, half. Very important.
You can't forget the half.
Yeah.
Okay. So you didn't feel like you didn't belong there.
I think that there was actually, here's an interesting story. So there was a lecturer, I'm not going to say his name, but he was, I can't remember his background. I want to say he's from Congo. He was a lecturer, who taught medicine. And after me failing one of my exams in my first year, he was my tutor. So he basically said to me, Francis, if you keep going the way that you're going, you're not going to make it through med school. And I remember at the time when he said that to me, I was really annoyed, and I was thinking, how dare he say that to me? But I think that looking back at that sort of experience, he said it for a reason. He didn't say it because he wanted me to be kicked out. He said it because he knew that I wasn't working to my potential. Yeah. And I think that the reason he said that is because he is from a similar culture, and he's probably seen people who are taking things for granted. And obviously we should make the most of our opportunities because our parents have made sacrifices for us. So I think that that's something that was really important to me. And I think that, yes, we do have certain challenges because certain like literature and pictures of dermatological conditions, skin conditions and things like that, they don't necessarily reflect our skin and our skin type. So there are things that you notice, okay, that isn't necessarily catered towards me, but you use those things as fuel. And I think that it's testament to see where you are, and it's testament to see where people like you are.
Yeah. Was it when you talk to other colleagues who went to different universities, did Leicester seem a bit excessive in terms of how many people failed exams or maybe even dropped out of the course? Just talk to us about that.
So in my second year of uni, 50% of people failed a particular exam and had to retake it. Wow. And if I remember correctly, year by year, from first to third year, we lost about 25 to 30 people. So that represents about 7 to 9% of the year dropped out per year for the first 3 years. And speaking to other people, that was not the case. So, and also the Leicester curriculum was extremely rigorous. I remember my fourth and fifth year, I revised for my exams in my fourth year for maybe 4 to 5 months. And then my fifth year, I revised for 5 months. And by revision, I mean every single day. Towards the end, like the entire day, I neglected gym. I neglected elements of self-care. I was reading. But Leicester was tough for sure. But
why?
I don't actually know. I think that they have a curriculum that was initially linked with Warwick's curriculum, and they pride themselves on the fact that they have an element of sort of cadaver-based learning, theoretical-based learning. They're very big on communication skills as well. And I think that they wanted to make sure that anybody that got through had earned the right to get through and was prepared for life after medical school.
Yeah. Okay. So just as we round off this bit on medical school,
right?
If somebody's thinking about medicine as a career,
yeah,
what considerations should they make that might tell them that it's not a career for them or that it is a career for them?
Okay. So I think the things that are important to do are to talk to people. It's important to have people that you can talk to who maybe are either a doctor or in the third, fourth year of medical school, and ask them, how much revision do you need to do? What is your work-life balance? Are you stressed? Asking those questions and finding out, and actually speaking to people who are actually practicing as doctors and asking them about their daily routine, because ultimately, if you're not able to make certain sacrifices and you think I'm doing it for prestige or doing it for the title of doctor, then that isn't necessarily the right thing to be doing. So there's no shame in dropping out of any particular course, so long as you think to yourself, okay, the majority of my career is going to be from the ages of, 40 to 60 working in that same role. So it's not about how life is as a foundation doctor, which is in your first couple of years post-qualification, or even the next few years. It's about the longevity of career. So sort of shadowing people, doing work experience and speaking to those people. And those are the people who will give you honest opinions.
Yeah. And would you say that your perspective of medicine has changed from when we were in secondary school or sixth form to now, how you view it as a career? How would you say that's different?
I think it's very different. I think that the things that I am aware of now are, I love the autonomy. So I think that one of the reasons I went into GP was because I like the decision-making side of things. And one of the things that frustrated me about hospital medicine to an extent was, I guess you always have to sort of run things by your senior. And as you feel as if you're getting more confident, it's great to sort of develop a personal relationship with somebody, make decisions, have pride in your work, rather than sort of collecting information and discussing it with your senior, which obviously helps to build up your confidence.
Yeah.
And I think that as a career generally, it's something that isn't necessarily what you expect. I think that it's stressful at times, it can be thankless at times, but now and again you get glimpses of things where you think, okay, this is why I do it. This patient is shown they're extremely satisfied with my care. They've written a letter about me. They've kind of said something to one of the reception staff or one of the other GPs there, and those are the reasons why you do it.
Yeah. So talk to us about okay, you finished medical school.
Yeah.
Tell us your journey from the first year working as a doctor to now.
Wow. So for people that don't know, so after medical school, which is 5 years, so at most universities it's 5 years. At some of the universities, particularly the London ones, you do an extra bachelor's degree, and it can be 6 years. So I did 5 years from 2010 to 2015. After that, I went to Birmingham, and then you do 2 years of foundation training. And that, essentially that's sort of your learning years where you are independent in your practice, and you end up doing lots of unsociable hours, night shifts, day shifts. You do rotations in different specialties, and you learn as to which specialty that you like to work in, because you do 4-month rotations. So for me, it was interesting. I was out of my depth at times. I was stressed at times. I had no social life at times, but it made me think after doing GP in that second year, I actually like this particular rotation.
What did you think you were going to do before you landed on GP? Where were you leaning towards?
It was either GP or a medical specialty.
Okay.
But similar to you, I think that the business side of things is something that's important to me. And to put things into perspective, if I wanted to be a medical consultant, that would have been after medical school. You're talking about 8 to 10 years of total training before you're a medical consultant, and usually a decade, because there's lots of research that's involved there. So I think that making that sort of sacrifice to become a medical consultant and not necessarily enjoying that time period and getting the right work-life balance wasn't something I was willing to compromise on.
Yeah. Okay, so you said that you had sacrifice on some on a social life.
Yeah.
So how about for people that, you know, they like to plan out life, and they're like, you know what, I'm going to get my degree in medicine, I'm going to become a doctor, then I'm going to get married 2 years after graduate. Like, is there even time for relationships, and, you know, how does that all work?
Okay, so I think that in terms of actually living a balanced life, there will be times where you just can't, because you're having to revise for a postgraduate exam in order to get into a GP training or a surgical post, etc. And at the same time, you're working. So having to put the hours of revision in after work, you're tired already. You know you need to pass the exam because the exam costs £500 or whatever it costs. Those are times where you really have to make sacrifices.
Yeah.
As for sort of things like relationships, yes, there's always time for it, but it's about finding somebody that's understanding, somebody that understands the sort of sacrifices you're going to have to make and how long it's going to pan out for. But as you know more than anybody, sort of the direction you go in, it's never linear. There's going to be ups and downs. There's going to be steps backwards. There's going to be steps sideways. So long as you sort of make that general progression forwards, I think that it all adds to the story.
Yeah. And again, I want to come back to that thing of, okay, in medical school, how was it in terms of feeling accepted and welcome and that sense of belonging? How has it been as a foundation? How was it as a foundation doctor? And how was it when you were training for GP and now as a GP?
Okay. So I think that you must get this a lot, actually. Like, all the time people say, how old are you? Like, how old are you? Are you qualified? Like, I think that one of the beauties of Black Don't Crack is is the fact that you still have that youthful appearance. And I think that one of the things that I've always got since being a GP is people asking how old I am and asking how long you've been qualified for, or you look young. With respect to sort of being a Black African, I think that one of the things that you sometimes get is sort of certain patients, not all the time, but certain patients sort of asking certain questions, or where are you from, and the inferences of what that actually means. You're like, okay, yeah, I'm from Derby. Is that the answer that you want? but I think that in the main, you definitely are in situations where sometimes you look around and you're the only person that represents your particular culture. And thinking about Birmingham, I actually only know one GP partner in the entire Birmingham. I'm sure there's more, but I've only met one so far. So I think that it can be difficult when you look around and you don't necessarily see people like you, because there is an element of camaraderie that comes with cultural similarity. And I think that seeing people that are similar to you helps you to sort of understand, okay, this person made it, why can't I?
Yeah. So how do you then handle that? What do you do? Do you do anything differently? Do you change yourself? How do you deal with that?
I can't even lie. I can't even lie about it. So I think that certain things that I did initially, where you almost try and make yourself extra friendly, and it shouldn't be like that. Like, I know at times when, because obviously we mentioned that previously and whatnot, but like, you kind of make yourself smaller. So you think to yourself, okay, I'm coming into this situation. I don't necessarily look like the archetypal or stereotypical doctor. So I'm going to make myself seem overly friendly. And sometimes you do that. But I think that as you get more senior and you become confident in your role, and you know, it doesn't matter the way that I look, end of the day, I deliver a service that I'm proud of. So you think to yourself, okay, now I can just be me. And actually having somebody that has good conversational, communicational skills, smiley, all those sorts of things, patients appreciate it because of the fact that you can actually have a conversation with them, and it's not kind of like, I'm the doctor and you're the patient. It's kind of like, okay, I'll deliver a professional service, but we can talk back and forth.
Yeah, that's good. And I guess I might be giving people the impression that, it's all serious and, and work, but, I've seen that you've been on trips, Dubai, America, different places. You've sold out now. You're a PSG supporter.
No.
But it looks like you're PSG now. Tell us some of the things, opportunities, I guess, you've been able to have because of your position.
Yeah. So I think that all work and no play makes Francis an idle, boring boy. So that is not me at all. I'm extremely big on traveling. Obviously, with coronavirus, it's limited. But as you said, I've been to many places. I've been to Mexico, America. I've been to Barbados, Dubai, like you said. And I think that prior to coronavirus, I was trying to go on at least 3, 4, 5 holidays a year. And like, you can fit it in. So long as you plan it in advance, you can fit these things in. And I think that all the hard work and sacrifices that you put in, they have to reap some sort of dividends in the future. And on top of that as well, I'm big on the gym. So I'm in the gym prior to coronavirus again, 4, 5, 6 times a week.
Man,
I've got a decent social life. I think that it is what you make it. As a GP, you can work as much or as little as you want to. I know people that work 3-day weeks, keep it at that and enjoy their life. People like me, we kill ourselves working 6, 7 days a week, but there is still balance. There is, so long as you've got a passion for something, you can fit it in. And I think that you have to be organized. You have to sort of plan things, but there's no sort of compromise. There are times when you can definitely enjoy yourself, and there's more to life than work.
And at this stage where you're at, it looks like you've got a lot of flexibility. So at the start, you're telling us about the different roles that you've got. Just explain to us the flexibility of where you are now, because I guess the typical traditional route for someone like you is you're 5 days a week in a practice,
right,
at 9 to 5 maybe, and that's the impression that people get for a GP, but you're doing things differently. And self-employed, employed. Just talk to us about those things which people might not be really aware of.
So there's a big business side to things to being a GP. So you can take the usual contractual side of things, and I guess work for GP partners who own the building and own the way that the practice runs.
Mhm.
So those are salaried GPs that work underneath them. You go to work, you work your 9 to 5, you go home and you live your life. Then there's locum GPs. So as a locum GP, you're self-employed. So I'm a part-time locum GP, which means that for the 5 days out of the week that I may decide to work or may not decide to work, because there's flexibility to it, I'm self-employed. And obviously you know this, but just to explain to everyone else, that means that you end up getting paid into your company that you make for yourself. And then you sort of pay corporation tax rather than paying your usual sort of PAYE sort of income related tax. And you can claim expenses. There's lots of things that are beneficial to being self-employed, and the flexibility that you talked about as well means that you can work as much or as little as you want to, and I can work weekends, I can take days off, I can work a really long day, I can work short hours. It's something that is great because you can fit life around, you can fit sort of work around life, or vice versa. There's the flexibility that comes in between that.
What are the negatives of the position that you're in as opposed to if you were employed and working under somebody else at a GP practice?
So I think that as a locum GP, so self-employed GP versus being a salaried GP, the only things that you don't necessarily get are you do not get your sick leave, you do not get your study leave. So obviously there's sick days you can take and still get paid for if you're a salaried GP. Other things that are slightly different as well are that you probably, well, any wise person who works self-employed should take out sort of income protection and things of that nature, critical illness cover, so that in the event that something does go wrong to your health and you cannot work, you still get paid by your insurance company. So there are little extra things, and obviously having an accountant, having people that make your life easier are really important when you're self-employed, because you need to look after yourself as a person and make sure that actually I'm not just working willy-nilly, I'm working smart.
Okay, and that's good. Within dentistry, there's a big difference pay-wise as well between you being employed, let's say in the hospital, in the NHS, as opposed to you being self-employed as a general dentist. Is there that same parallel in as a GP, if you're a locum and if you're working employed within a practice? Is there a big difference in pay?
So there is a substantial difference in pay. So I don't know whether I should get into facts and figures, or
you can get averages. You can be as open as you want.
Okay. So as a salary GP, so your typical salary GP will work anywhere from, I don't know, 4 days out of the week to 5 days out of the week. And your salary GP, in terms of facts and figures, is probably getting paid anywhere from about 60 to 80, 90. If you're working anywhere from 3 to roughly around 4 to 5 days out of the week. So that's what a typical salary GP will get. As a locum GP, you're getting paid hourly. So you're getting paid via an hourly rate. So the hourly rate probably will be anywhere, depending on geographically where you work in the country, from about 80 to 100 an hour. And if you extrapolate that for somebody who's working full time, I've not done the maths, but you're probably talking 140, 50, something like that. That's probably the full-time equivalent of working as a locum versus working as a salaried. And obviously, there are some differences as a locum. When you go to a new practice, sometimes the practice are like, oh, I've got a locum doctor, I'm going to dump work on him. And you're there thinking, man, is this really worth it? but I think that the flexibility that it brings, and at the end of the day, when you put in work, you want to make sure that you get something out of it. So it's kind of understanding those are the drawbacks and thinking, okay, I actually enjoy these pros that are here.
So it looks like you've conquered the world. You've gone into GP. What more do you do? What else do you do after becoming a GP?
That's a good question. I'm at a stage now, I'd say, in life where I'm happy with my career. There isn't much that I would change about my career. It's kind of rounding off and polishing off the things that I want to do outside of work. So I think that one of them obviously is to find somebody.
Yeah. Hey, get hooked up, get married. If anybody's watching.
Yeah. Nah, but in all seriousness, I think that one of the things I want to achieve at some point would be to find somebody, have family, children. I think that giving back is important. So I think that having a Nigerian family, Nigerian parents means that being able to give back to where I came from and to make the trip, which I really wanted to do, if not for coronavirus, things like that will be so important, because I think that when you go there and you actually see people that you have actually derived from, and this is where my parents came from and this is where I am now, sort of seeing that face to face, which I've not seen in a very long time, is something that's really important to me. So I think that having a wider life and a wider spectrum of sort of where I've come from, it's something that I really want to explore as I get older.
All right. So it looks like at this point you're using the freedoms that your career gives you to now explore other things in life that you really want to do.
Yeah, for sure. I think that work is obviously a means to get the income and get the resources in order to do the things that you're actually passionate about. So whether that's, I guess, being passionate about exercise, which I am, or being passionate about traveling, or being passionate about giving back to my family, those are things that we can do now that are in a certain position. Because I think that, I'm sure you've had this, when the look on your parents' faces when actually things that you actually buy for them and they were like, wow, like my son bought me this. That things like that make you feel really, really good. I think that giving back to them, following all the sacrifices they've made financially, time-wise, emotional sacrifices that they've all made, sort of going, doing that whole 360 and sort of seeing those looks on their faces is something that is amazing, really.
Yeah, no, awesome. I think just because of time, we could be going at this for hours. But I really want to ask you, if people want to find out more about getting into medicine, becoming a foundation doctor, or even specializing, what's the best way for them to get a hold of you?
Yeah, so the best way to get hold of me, I guess there's a few different means. So there's obviously email address. Shall I plug my email address?
I can put it in the description.
Cool.
That's cool.
Yeah, so via email, I'm on Instagram. There's also other ways, I guess. So I'm part of different societies locally in Birmingham as well. So there's different means which I'll plug to you later on. So I'm more than happy to be contacted and try and share my experiences with people.
Awesome. And if you were to summarize what is medicine to you, how would you summarize it?
Going back to medical school interview now. I think that to me, medicine is the way that we interact personally with other people. And I think that to me, medicine has given me the opportunity to share the knowledge that I've attained with other people, to try and make them aware that medicine is a holistic thing. So there's many different ways to treat the same condition. So there's obviously the medication side of things, there's the psychological side of things, there's the physical side of things in terms of lifestyle, etc. So I think that medicine encompasses all those things together. It's just a very diverse and multifactorial thing.
Awesome, guys. I'll put the details all in the description box. What I'd ask is, if you subscribe, make sure to turn on those notifications, find out about the other videos that we've been making on this channel, and we'll catch you at the next one. Thank you, Francis, for coming on today.
Really, really appreciate it. Pleasure catching up as always.
I'm hoping to apply to dentistry as a graduate, and today I entered the Dental Mentor MMI interview practice. I learned a lot more about the types of interview questions, how to portray myself at interview, and I also got a lot of helpful feedback on things I should change, things I should say and things I shouldn't say. So overall, I found this experience very, very helpful.
It's really helped my confidence. Up until now, I was really worried about the interviews. I didn't think I really knew how to do it and didn't think I'd do particularly well, but after today I have a lot more confidence in myself. I realised that actually I can do it and it is doable.
The workshop today really helped me a lot with the interview prep. They gave really constructive comments and very personalised comments as well, so I really enjoyed it.
If you're thinking about studying dentistry, whether you're in college or whether you're in a degree right now, I think just have a chat with them and they will help you from start to finish.